Do you ever find yourself feeling a little less steady on your feet than you used to? Perhaps you've noticed yourself holding onto furniture more often when walking through your home, or have a lingering worry about losing your balance, especially on uneven ground. These feelings are common, but they're important signals from your body. For many older adults, maintaining safe movement and knowing when to use mobility aids is a crucial step to preserving your independence, reducing your risk of falls, and continuing to enjoy life to the fullest. It's easy to dismiss a slight wobble or to avoid certain activities due to a fear of falling. However, this can inadvertently lead to a more sedentary lifestyle, social isolation, and unfortunately, increases your actual risk of a serious fall, which can be devastating to your health and independence. You might even feel a discomfort or stigma about using a cane or a walker, thinking it signals weakness. But the reality is that these tools are incredibly empowering. They provide stability, confidence, and the freedom to stay active and engaged. Ignoring minor balance issues or delaying the use of supportive aids means unnecessarily risking your well-being and limiting your life. In this video, I'm going to share 3 crucial insights about safe movement and mobility aids for older adults, key signs that you might need extra support, how different mobility aids can enhance your safety and independence, and most importantly, practical tips for choosing and using them effectively, helping you move with greater confidence and freedom starting today. Before we dive into these vital insights, if you're committed to staying safe and independent, please hit that like button right now. It truly helps us share this crucial information with more people who need it. And don't forget to subscribe to our channel and ring the notification bell so you don't miss our next helpful health tips designed just for you. Finally, let us know in the comments, safe steps, if you're ready to move with more confidence today. All right, let's start by recognizing the important warning signs that might indicate you could benefit from some extra support. The first crucial insight is to recognize the warning signs that suggest your balance or stability might be compromised, indicating that you could benefit from some extra support. Don't dismiss these subtle signals. As we age, several factors can affect our balance and stability. A natural decline in muscle mass and strength, particularly in the legs and core, can make us less steady. Reduced depth perception, glare sensitivity, and diminished peripheral vision can make navigating uneven surfaces or obstacles challenging. The inner ear's balance system can become less effective. Many common medications can cause dizziness or drowsiness as side effects, impacting balance. Conditions like diabetes can cause neuropathy, affecting sensation in the feet. These factors can lead to subtle signs that, if ignored, can increase your risk of falls. Warning signs to watch for include feeling unsteady or wobbly when walking or standing, holding onto furniture, walls, or other people to maintain balance, difficulty walking in a straight line or turning around, tripping or stumbling more often than usual, even without falling, fear of falling that limits your activity or causes you to avoid certain places, dizziness or lightheadedness when standing up quickly. These are not just normal aging, they are calls for attention and potential intervention to prevent a serious fall. My friend Frank, a spry 77-year-old, loved taking walks in his neighborhood. But over the past year, he started noticing he'd occasionally feel a slight wobble, especially when turning quickly. He'd find himself grabbing the railing more firmly on stairs. He initially dismissed it, thinking, I just need to be more careful. However, after a near fall in his kitchen when he reached for a high shelf, he decided to speak with his doctor. I was embarrassed to admit I felt unsteady, Frank confessed. But my doctor said that recognizing these signs is smart, not weak. He recommended a physical therapist who assessed my balance. Frank's proactive approach, spurred by a clear warning sign, allowed him to address his balance issues before a serious fall occurred. For you, recognizing these warning signs is the crucial first step to proactive safety. Imagine feeling more secure in your movements, knowing you've addressed potential balance issues before they lead to a dangerous fall, preserving your confidence and independence. Don't ignore subtle changes in your balance or increased unsteadiness. Discuss any concerns you have with your doctor or a physical therapist. They can perform balance assessments and recommend appropriate steps. If you're paying attention to your body's signals, let us know by commenting balance check below. Once you recognize a need for support, understanding the different types of mobility aids available can help you choose the right tool to enhance your safety and independence. Discovering how different aids provide tailored support for your needs. The second crucial insight is to understand that mobility aids are empowering tools, not signs of weakness. From canes to walkers, each type offers a different level of support, allowing you to choose the best fit for your specific needs and maintain your confidence and independence. Mobility aids work by expanding your base of support, redistributing your weight, and providing a stable point of contact, thus reducing the risk of falling. These offer minimal support, primarily for balance, and are often used if you have mild balance issues or weakness on one side. Basic support for balance. Have 4 feet for a wider base, offering more stability than a single point cane. These provide greater stability and support than canes, distributing weight over a wider area. Offer maximum stability, but must be lifted to move. Have wheels on the front 2 legs, making them easier to push but still requiring some lifting for the back legs. Have 4 wheels, hand brakes, and often a seat and basket. They are easier to maneuver and provide support for those who need to rest frequently, but they require good balance to control. Choosing the right aid depends on your specific balance issues, strength, endurance, and terrain you'll be navigating. The right aid can transform your ability to move safely and confidently, opening up your world again. My friend Martha, a vibrant 80-year-old, had a severe fear of falling after a bad stumble. She started to avoid leaving her house, feeling she was losing her freedom. Her physical therapist suggested she use a lightweight rollator. Martha initially resisted, saying, "Oh, I'm not that old. I don't want to look dependent." But her therapist explained how it would give her back her freedom, not take it away. After trying it, Martha was amazed. "It's incredible," she exclaimed. "The wheels make it so easy to push, and the brakes give me confidence. I can walk to the park, visit the store, and even sit down on the seat if I get tired. It's completely given me back my independence to go out and enjoy life." Martha's story demonstrates how embracing the right mobility aid can be a powerful tool for freedom and confidence. For you, understanding the various options and their benefits means you can choose an aid that precisely matches your needs. Imagine moving with confidence and ease, knowing you have the right support to maintain your independence and continue enjoying your favorite activities. Don't view mobility aids as a sign of weakness, but as a strategic tool for safety and independence. Discuss your specific needs with your doctor or a physical therapist who can recommend the most appropriate type of aid for you. If you're open to exploring mobility aids, type empowered movement below. Once you have the right aid, the next critical step is ensuring you use it correctly and safely, as an ill-fitting or improperly used aid can actually increase your risk of falls. Learning the correct technique for maximum safety and comfort. The third crucial insight is that simply having a mobility aid isn't enough. Proper fit and correct technique are absolutely essential to maximize its effectiveness and prevent injuries. An ill-fitting or improperly used aid can actually increase your risk of falling. A mobility aid that is too tall, too short, or used incorrectly can throw off your balance, cause strain, and make you less stable. Canes and walkers must be adjusted to the correct height for your body. Generally, when standing upright with the aid, your elbow should have a slight bend about 15 to 20 degrees. If it's too high, your shoulders will hunch, too low, and you'll stoop, both compromising balance. The cane should be used on the opposite side of your weaker leg. Move the cane forward first, then step with your weaker leg, then your stronger leg. The walker should be moved slightly forward, then you step into it. With wheeled walkers, ensure you don't push it too far ahead of you, as this can cause you to lean forward and lose balance. Your home environment also plays a crucial role. Clutter, loose rugs, poor lighting, and uneven surfaces can become major fall hazards, even with an aid. Ensuring clear pathways and proper lighting is vital. A physical therapist is an invaluable resource for ensuring your aid is correctly fitted and teaching you the proper techniques for safe and confident movement, not just with the aid, but also for sitting, standing, and navigating obstacles. My friend John, a determined 72-year-old, was given a standard walker after a knee surgery. He initially struggled with it, finding it awkward and feeling more off balance than before. He'd push it far ahead, then shuffle to catch up, which made him feel less secure. His doctor referred him to a physical therapist who immediately noticed the walker was too tall for him and showed him the correct walker, then step technique. It was night and day, John exclaimed. The therapist adjusted the height, and suddenly it felt like an extension of me. Learning how to move with it, instead of pushing it, made all the difference. I actually felt safer and more confident. It taught me that it's not just having the aid, but how you use it. John's experience highlights the vital role of professional guidance in safe mobility. For you, ensuring proper fit and learning correct technique means you can use your mobility aid effectively and comfortably, truly enhancing your stability and preventing falls. Imagine moving with confidence and grace, knowing your aid is working optimally for you. If you are considering a mobility aid or already use one, ask your doctor for a referral to a physical therapist. They are experts in assessing your needs, fitting the aid correctly, and teaching you how to use it safely and effectively. Also, assess your home for fall hazards and clear clutter to create a safe environment. If you're ensuring safe movement at home, type home safety in the comments. Now that you understand the warning signs, types of aids, and importance of proper use, let's delve deeper into specific how-to tips for safe movement and common pitfalls to avoid. Conduct a fall risk assessment in your living space. Remove loose rugs. Ensure good lighting in all areas, especially stairs and bathrooms. Clear clutter from walkways. Install grab bars in bathrooms. And consider handrails on both sides of staircases. Wear supportive, non-slip shoes with good traction. Avoid walking in socks, slippers without good grip, or loose-fitting shoes. Consult a physical therapist for exercises tailored to your needs. Simple exercises like standing on one leg while holding on to support, heel-to-toe walking, or gentle tai-chi can significantly improve balance and leg strength. When getting up from a chair or bed, push up with your arms, lean forward, and push off with your feet. Don't pull yourself up using furniture or an aid that isn't stable. Avoid carrying too many items at once, which can affect your balance. Use a walker with a basket or make multiple trips. Don't rush, especially when standing up, turning, or navigating new environments. The biggest mistake is letting pride or fear prevent you from using a tool that enhances your safety and independence. An aid that's too tall, too short, or not suited for your strength can actually increase your fall risk. This shifts your center of gravity too far forward, making you unstable. These could be signs of medication side effects, dehydration, or other medical issues that need to be addressed. Overloading yourself or carrying items in one hand can disrupt your balance. Mobility aids are supportive, but maintaining your own strength and balance is crucial. For comprehensive assessment and personalized recommendations regarding safe movement and mobility aids, your best resource is your doctor or a physical therapist. A physical therapist can assess your balance, strength, and gait. Recommend the most appropriate type of cane or walker for your needs. Properly fit the aid to your height and body mechanics. Teach you the correct and safest way to use the aid. Provide exercises to improve your balance and strength, reducing your reliance on aids over time. Don't hesitate to seek their expertise to ensure you move safely and confidently. So, as we've explored, understanding safe movement and knowing when to use mobility aids is one of the most powerful steps you can take to protect your independence and enjoy life to the fullest in your golden years. We've seen how recognizing warning signs early can prevent falls, how different aids can empower you, and crucially, how proper fit and technique are vital for safety. The beauty of gaining this knowledge is the control it gives you over your own well-being and mobility. I understand that thinking about balance issues or using a mobility aid can be concerning and sometimes even emotionally challenging. It's natural to want to avoid unpleasant truths or feel a sense of loss. But ignoring these vital facts means risking a serious fall, which can lead to injury, pain, reduced mobility, and a significant loss of independence. Don't let hesitation or misunderstanding prevent you from securing your safety and freedom. The wonderful news is that you have the power to move safely and confidently. It is never too late to assess your balance, seek professional guidance, and embrace the tools that can truly enhance your quality of life. You have the right to move freely, to pursue your passions, and to live a life full of vitality and joy. You have the power to make that choice, starting today. As you've discovered, prioritizing safe movement and understanding mobility aids isn't just about preventing falls. It's about recognizing your body's needs, embracing supportive tools, and empowering yourself with knowledge to maintain your cherished independence. It's about safeguarding your confidence, your freedom, and your ability to fully experience the world around you. After watching this video, what's one new warning sign you'll pay attention to, or what's a step you'll take today to improve your movement safety? Share your thoughts and experiences in the comments below. We'd love to hear from you and build a supportive community. If you found this video helpful and valuable, please take a moment to like it. Your support truly helps us continue to create content that genuinely empowers our community. And if you haven't already, subscribe to our channel and hit that notification bell so you'll be the first to know when we release new crucial health insights. Most importantly, if you know someone, a friend, a family member, or a neighbor who might benefit from understanding safe movement or mobility aids, please share this video with them. This information could be the spark they need to gain confidence, prevent falls, and live a more active, independent life. Wishing you and your loved ones continued safe steps, confident movement, and abundant happiness. Remember, your independence is precious. See you in the next video.